Hi, I'm Dr. Coleman. This is your apple per day. Oh, there's Dr. Graw. Well, hello there, Dr. Graw.
Dr. Coleman, how are you today?
I'm fine.
What do you have going on?
Well, I'm roasting apples, and I thought we'd talk about burns today. Would you like to help me out?
Sounds wonderful. I'd love to help you.
Good. Well, here, take this. Try this on.
If it fits, I should wear it probably, right?
I think so.
I think it looks perfect to me.
Good. These apples are really coming along nicely.
They do. They look like they're about ready to talk about.
Well, you know, we're roasting these apples on a very fancy grill here, but not everyone has a grill like this.
You know, this has a lot of built-in safety precautions because it's large and elevated, and the natural thing is to stay away. It looks like it's overpowering, but not everybody does that. Everybody has different kinds of grilling mechanisms. I know over the years I've had little charcoal grills sitting on the beach. People build things that just burning logs, and they try to get those going, and it's a natural temptation to reach in there and try and readjust the logs, or if the fire's not going right. I remember going to barbecue parties and people throwing, they'd never do this, right? Throw gasoline right on the fire, okay, to make it grow faster, right? And that's completely dangerous. Frequently it'll flame up, come back on the person throwing the gas. So definitely no fire igniters or gasoline thrown on the grill to make it go better.
That's great. Well, I guess, though, if you do have a grill, you're going to be using propane. We have a tank here, don't we, that uses
right,
gas?
And I think even hooking the tank is important. First of all, you want to make sure you've got a full tank, and they all come with safety precautions. You have to have the wrench. You need to put it on prior to turning on the grill, and make sure that as you put on the tank, it's not spewing the gas and there's not an accidental explosion. The gas can build up under the hood, and then all of a sudden somebody goes to light it and the flames will come back and burn the person who's ignited the fire. So you want to make sure everything's in the off position. You put this on carefully. The other thing I always like to make sure I have, and sometimes it's even hard to find because you don't think you're ever going to use it, is one of these dandy fire extinguishers. And they're nice to have, and you keep them outside. You never know when one of these things will overflame, and then suddenly somebody will say, I don't know what to do. Obviously you're going to turn it off, but you need to put out the fire as well.
So I guess prevention is the key.
Prevention is the key to most accidents. But we need to know what the potential pitfalls are. If you don't know what they are, you can't prevent them. And I think some of the things that we always tutor our children about is don't touch, don't touch. And even though we say that, people will be accidentally touching the grill. It'll look like it's cold, it's shiny, it's clean, and they'll reach over and touch it, and then they're burned. What are the kind of burns? I think there are a couple different kinds of burn. What can you do with it?
Well, you know, we grade burns by maybe 3 different characteristics: the location, the thickness of the skin that's damaged, and how large an area is damaged. Obviously, any burn on the face is severely serious, and we're getting quite concerned. But in terms of thickness of the skin, a first-degree burn really doesn't damage the skin, but the skin is broken. That area is usually just red and tender. But if you start developing blisters, then that lets you know you're getting into the second-degree kind of burn. That's a little bit more serious. That's involving the topmost layer of the skin, and it blisters up.
I've heard people say they reach over and touch the grill and the skin is left right on the grill.
Yes, that can happen. And then that lets you know that if some of the skin is left there and the skin looks white underneath, you've had a full thickness burn, and that's the third-degree burn. So we grade those by how deep the burn actually goes through the skin, or just part of the skin, or just the top layer that turns red.
That sounds pretty serious then.
That can be very serious. Yeah, that can be very serious because, as you know, the skin protects the body from loss of body fluids and also from infection. So if the skin is broken, then there's always that risk for infection, and a third-degree burn can put you at much greater risk for loss of body fluid. So that's something we really get very concerned about.
A lot of people come in and they say, I've got a little blister. What is that kind? That's like,
well, the blister
in between.
That's in between. That's kind of, we call that a second-degree burn. That's kind of that lets us know that you've gone from being the most mild kind of burn, the first degree, to getting into the next layer of skin, which is the second-degree burn. But that blister, even though if it's intact, still serves to protect your body from infection. So you shouldn't break that blister if it's not broken through the burn itself.
So putting a needle in and drawing that fluid out like my mother wanted to do is not the right thing.
That's probably not the thing to do because it still serves some protection there. And you should wait until that blister breaks naturally on its own, because then that lets you know that the burn is probably healing from the inside out.
Sounds great.
Yes. Well, Dr. Graw, as a pediatrician, when do you recommend that people go see a doctor after they've been burned?
Well, there are lots of people who treat their own burns, right? When you get that little blister, you know, you can touch something hot, or even touching a match, you get that little red blister. People don't tend to go to the doctor very often. Usually it's the area involved. If it's a critical organ, such as in your face or your eye, around your nose, in your mouth, I always have people telling me, let me borrow this. trying to sample what's on the grill to make sure it's just perfect. And they'll take this hot piece of meat or whatever they're grilling and put it up on their mouth or lips to take a bite. Clearly not the right thing to do. When it's a vital area, when it's an extensive area, and when it's deep, any of those, they need to go to a physician. We see a lot of people at Righttime Medical Care for that type of burn, and the treatments that we give are extended home remedies, meaning trying to cut down on the pain, usually by putting it in cooling fluids to cut down on the degree of damage as the tissue continues to metabolize and destroy itself, and then protecting it with a covering. Sometimes we'll put on an antibiotic ointment, sometimes we'll just put on a non-sticky dressing to protect it so that infection can't go into that open area.
Well, in terms of home remedies, I think the first thing you should think of doing is removing the damaged body part from the heat. And one of the first things is to really cool that area with running water. You can use cool running water to chill or cool the area down that's been burned. I've heard of people using butter sometimes. Have you ever heard of that as a remedy?
When I was a young boy, my mother used to say put butter, Crisco, even heard you could put oil on a burn. Never felt good. It always felt worse, right? And I used to run to the sink and run it under cold water. She'd say, stay away from that cold water. It's not the right thing to do. And then the Russians showed that immersing the injured area in cool water actually decreased the amount of damage occurring in the tissues because they're no longer being degraded. So no, we do not ever recommend using that butter or a Crisco on it.
What about blisters? Sometimes people want to break those blisters open. Do you think that's a good thing to do?
I think for safety, you do not want to rupture that blister prematurely because that blister is protecting the skin underneath. There will be a time which we will then remove the blister as soon as the tissue is ready to handle itself. But when we do it, we always cover it with a special antibacterial cream or ointment and or a non-sticky dressing. We want to be careful not to use a medicine that contains neomycin. So Neosporin is not the right medicine to use. You can use bacitracin or polysporin that does not have the neomycin in it, and then you won't have the chance of having an allergic reaction.
Well, I'm sure that most burns also hurt, that there's some tenderness in that local area, so sometimes taking some medicine by mouth might help as well. What do you suggest there?
I think, again, Motrin is very good. It interferes with the damage that's occurring. So Motrin, Advil, any of the ibuprofens will help cut down on the damage that's progressing underneath the skin. Tylenol also will help if you have a person who is intolerant to the ibuprofen.
So, what do you think the major points that we should keep in mind about burns?
Well, avoidance, clearly, right? I think when we're building that fire, keep everybody away. You never know what's going to happen. If you have the hot coals you're trying to light, if you have fluid that you put onto the coals, if you're building a wood fire, have that fire extinguisher nearby, making sure that everybody's aware of how dangerous this could be. I think that if we can prevent the burn, we're going to be safe. If once the burn occurs, then it leads to what you described, and that is what kind of burns do you have and what do you do for it? What are the kinds of burns again?
Well, I think we should remember that there are first, second, and third degree burns based on the location, the depth of the burn, and how large the area is involved. So at that point, if you have a severe burn that's involving your face or a vital organ or that looks like a second to third degree burn, you should seek medical care. And Righttime Medical Care is an urgent care system that takes care of burns very well.
And you mentioned probably the first thing to do is put it in cool water. Cool running water, not ice, don't put ice on the burn, but cool running water, protecting it from infection.
And we should avoid using butter because butter does not help. We should not break that blister because it provokes infection. And then we should consider using an antibacterial cream, avoiding one that contains neomycin, and we should cover the burn.
And how about that tetanus shot? If their tetanus shot's not caught up to date, everybody should go down and make sure their tetanus shot's up to date before they get a burn like that.
That's a very, very important point. And then clearly, good follow-up with your private physician is very important. If you've gotten a burn that's required you to get medical care, you've got to be followed up. Well, I think we've about covered it. What do you think?
I think we've done a good job describing grill safety and discussed all the home remedies and when to go to an urgent medical care center. Let's see how these apples are doing.
Okay.
Let me grab this one for you. This one looks just about perfect. Put this mitt on, not to burn your hand, and let's see how this one really seems. It's dripping a little juice there. Looks just
good.
About perfect to me too. Looks great.
Well, this has been your Apple Per Day.
Stay healthy.